Good morning. Welcome to the American College's Financial Services webcast on the Ukraine crisis and how advisors can lead the conversation. My name is Dien Yuen. I am the Executive Director for our Center for Philanthropy and Social Impact. And so really appreciate you joining our session today. It's a very important conversation. And so we're very thankful for you to spend the time with us. I have two very, very special guests with me today. Anil Soni, CEO of the WHO Foundation, and then Sam Kang, President of Schwab Charitable. Let's get started. So I have Anil and Sam here. Anil, why don't we start with you? If you can just briefly introduce yourself, describe what WHO Foundation does, and then your relationship maybe to the WHO.
Sure. Thank you, Dien, for having me. My name is Anil Soni. I've worked for 25 years on expanding access to healthcare, helping to set up the Global Fund to fight AIDS, TB, and malaria, leading the Clinton Health Access Initiative, and heading the infectious disease business of a pharma company that supplies HIV medicines to 15 million people for 20 cents a day. At the WHO Foundation, I am now mobilizing more support from philanthropists and businesses to power the mission of the World Health Organization. The WHO is part of the United Nations, and it leads on health, from programs that evaluate new evidence and technologies to treat disease to the emergencies division that responds to outbreaks and works on the ground in health crises like Ukraine.
Thank you, Anil. Sam, let's go to you. Tell us about you and Schwab Charitable, please.
Great, Dien. Thank you for having me. It's great to be on the webcast with you and Anil. Let me first start by saying American College not only has great content and forums such as this, but as you know, I was also one of your students, so it's great to be here. A little bit about me. I've been in the financial services industry for over 25 years. And I'm so happy that I've been able to now bring that financial planning and philanthropy together. Just a little bit about our organization. Schwab Charitable is one of the largest national donor advised funds. Our team feels very fortunate to be in a position where we can help support the philanthropy of our donors and clients. We're an independent 501c3 charity. And our mission is very simple, and it's to increase charitable giving in the US. And we do that by making it very simple, efficient, and tax smart. And in fact, 70% of our donors say they give more to charities because they have a donor advised fund. So if you're not familiar with that, a donor advised fund, or commonly known as a DAF, is like a charitable investment account. And it's for the sole purpose of supporting charitable organizations that you care about. They allow donors to fund giving with other financial goals. So you can give with a wide variety of assets, including complex non-cash assets. You're then able to invest those charitable assets for potential tax-free growth and increase your impact over time. And then most importantly, you can then conveniently grant to 501c3 charities through our online tools and your mobile devices. So just last year, our donors granted more than $4.4 billion to over 114,000 charities. So, you know, our donors continue to be very active and generous supporters, especially with crises such as this, with relief and recovery efforts, and we're really proud of the impact that they're making.
Great. Thank you, Sam. It's so impressive, the work that you're doing in supporting the flow of philanthropy to the organizations that need it. There's so many questions about what's happening on the ground. So would love for you to share about, what is WHO Foundation doing? What's going on the ground? What are you seeing? How can people help? If you can elaborate, please.
Yeah, absolutely, Dien. And Sam, thanks to you for all of the philanthropy that you help mobilize, and thanks to those on the call for giving so generously, particularly in a moment of crisis like this. I know everyone on this call is reading the news and has awareness of the conflict in Ukraine. I'm going to try to bring that to life with some of the information from my colleagues at the World Health Organization who are working in and around Ukraine. In just 1 month, more than 10 million people, nearly a quarter of Ukraine's population. Ukraine is a major European country. It's the size of Spain in terms of population. 10 million people have been forcibly displaced. There's a lot of coverage on the refugees. Nearly 40% of that figure are refugees who have left the country, but the majority of that number of people are actually people who are displaced internally inside Ukraine. The humanitarian situation continues to deteriorate in many parts of the country. It's critical in Mariupol and Bucha districts. Humanitarian and health aid must be given safe passage to reach people in need. Food and healthcare are basic rights, yet nearly half of Ukrainians are worried about finding enough food to eat. There's indiscriminate shelling that's inflicting serious harm to civilians and to infrastructure, including to health services. So these are weapons exploding in heavily populated areas, houses, residential buildings, administrative buildings, hospitals, clinics, schools, water stations, electricity systems are all being destroyed on a substantial scale. There's obviously a focus in the international response to end the conflict, to ensure food and shelter for refugees crossing the border, but we also need to focus on ensuring healthcare, both to refugees and to the millions of people inside Ukraine. Disruption to healthcare services has both an immediate human impact and risks compounding the crisis. Ukraine already had high numbers of people living with HIV, hepatitis C, had dangerously low levels of vaccination against measles, polio, and COVID-19. Only a third of adults had been receiving a single dose of the vaccine prior to the conflict. Overcrowded, unsanitary living conditions for refugees are breeding grounds for cholera, other diarrheal diseases, as well as respiratory pathogens like COVID-19, pneumonia, tuberculosis. And equally, there's a need for the provision of routine care, from insulin for diabetes to obstetric care. Where do people go to find that care? More than 1,000 health facilities are in active conflict areas or less than 10 kilometers away from the front line. Half of Ukraine's pharmacies are no longer functional. We're in touch with many hospitals where 10% of the staff is still showing up. And the WHO has verified, and this is one of the jobs of WHO, incidents of attacks on healthcare facilities and healthcare workers, more than 70 as of this last week. So people need healthcare. They don't have the type of access they did prior to the conflict. And what the WHO is doing, to answer your question, is delivering healthcare supplies and emergency medical teams inside the country, because the WHO is already working in Ukraine and partners with the government there, which is still providing these services to make sure that healthcare workers and supplies can reach these people in need. Before turning back to you, Dien, I just want to bring this to life for this audience by telling you the stories of a few of the children at a hospital in Zaporizhia who've escaped fighting in the east and south of the country. And if my voice cracks while I share this, it's because these stories are atrocious. There's a 3-year-old named Artem who was in the blast radius of a Russian shell and now has shrapnel that had to be removed from his belly. The blast also injured his parents and grandparents who were fleeing Mariupol. There's a 13-year-old named Milena. She's considered lucky. She was hit by a bullet when traveling in a car that had a sign labeled children. She's going to make a full recovery, but her face is now scarred for life and the bullet hit one of her vertebrae. There's a 2-week-old named Misha who was born to the sound of gunfire in Tokmak. With no medical care, his birth had complications. He didn't have enough oxygen and is likely to have a neurological disability for the rest of his life. A 15-year-old girl, Masha, had to have her right leg amputated after a blast from a Russian artillery shell. And her doctor, Yuri, said that she was so traumatized that she wouldn't eat or drink for days and said, quote, that she could not mentally handle what had happened and we had to feed her intravenously. These are just a few of the names and stories of the people who were affected in Ukraine. And now is a moment when, if you have the privilege and power and resources to provide support, organizations like the World Health Organization desperately need that help in order to deliver care.
And yeah, that's heartbreaking. I'm actually a refugee myself. So it's almost reliving this trauma for my family as well. But when you talk about all this, the supply that's going in, are you having any issues? Can you get the supplies to where it needs to go?
Yes, thankfully. And not to say that there aren't issues, but I want to celebrate, or at least acknowledge, the success of my colleagues who are putting themselves in the crosshairs of this conflict. We deployed 24 medical teams, emergency medical teams. Half of them are in Ukraine, half of them are in neighboring countries to provide physical and mental health care. We also have raised resources, and the WHO immediately tapped one of its emergency funds so that they could put supplies together. Now, when I'm talking about supplies, I want to be very specific. This is essential medicine, trauma kits, surgical supplies, insulin, transfusion kits, medical oxygen, defibrillators, generators for electricity. This is the basic stuff that's required to deliver healthcare. We ordered and have now delivered 160 metric tons of those types of supplies, reaching more than 500,000 people. That's already in the first month. Obviously, a lot more people have needs. I'm really proud to say that the WHO has established direct supply lines to almost all cities in Ukraine, with shipments now in progress and more logistical lines being established. Sometimes bridges have been destroyed, they need to find alternative routes, but that is now happening. Supplies are getting throughout the country, and the WHO has set up an operational base in Dnipro in East Central Ukraine to be closer to people who are in greatest need. So operational facilities, bases are being set up, supply lines are open, and what we really need is resources so that we can get more supplies to people who are seeking care at those locations.
Just amazing work that your people are doing on the ground, Anil. Sorry, I'm just a little speechless with what's happening there. But we're facing COVID, right? Or the gradual, hopefully the lessening of what's happening with COVID. But when you talk about infectious disease, how does this COVID and all this craziness happening on the ground play out?
Well, we're just beginning to see this. So this is one of the challenges that I mentioned, the immediate focus, cessation of conflict, food and shelter. Healthcare is sometimes a second thought, but unfortunately, by the time people are responding, the crisis has already grown. So what we've already seen in terms of births, 80,000 women are going to give birth over the next 3 months in Ukraine. And the rates of preterm birth have gone up 2 to 3 times already in the first month. So when we're talking about infectious disease, essentially these types of settings are breeding grounds for infectious disease, whether they're diarrheal diseases, cholera. In the case of respiratory pathogens, yes, COVID, but also MDR, TB, and pneumonia. In the case of COVID, and again, that's one of a number of diseases that can spike in a moment like this. Only a third of the population had a first dose of the vaccine, which means this is a susceptible population to the pathogen, to the coronavirus spreading. There's not a lot of testing going on. And so that means people are going to have the virus, they're going to be sick, and some are going to be asymptomatic, but some are going to be symptomatic and are going to need medical supplies like treatment, like medical oxygen. And right now, that's not necessarily available. So there's almost no question that you're going to see a lot of coronavirus. The question that we can answer is whether or not we can ensure there are supplies to care for the people when they're getting sick.
Sam, I want to bring you into this conversation. What are you seeing from the folks that you're talking to? I mean, just reacting on what Anil just said.
Yeah, well, Anil, thank you for telling us those stories. That it really just helps us really understand the need that's out there. And Dien, the feelings that you're having just reminded me of my parents who lived, they were young, living through the Korean War, they were displaced, and all the stories, it just brings that right back to life. So, a couple things that we've been hearing as we work with charities. I'll give 2 examples. In one case, as Anil mentioned, the need, it's immense, and it's just spans across the entire charitable landscape. And we've heard across all sectors and how they're responding. And this one example, a well-known organization, president of the organization here in the US, he's focused on cancer research and care. So his organization has spent the last several weeks coordinating with international partners to help evacuate children with cancer in Ukraine that requires ongoing care. They're helping send patients to hospitals across Europe. They're bringing kids back to the US to ensure that continuity of the care that's needed. And they're covering all these expenses, whether it's travel, food and shelter, medical attention, it's all being covered by donors. So again, it's just all of these inspiring stories that we're hearing, and it's across multiple organizations. And we're looking at over 1,000 different charities that have been donated to specifically related to Ukraine. I will point in another example where a specific charity is just seeing different challenges, where I was speaking to a well-known global charity, and donors have really been contributing, and although they are getting an influx of grants and funding, what they're actually struggling with, it's been difficult to process and accept all the gifts. And one of the things that they point out is it's because there's the grants, when they're being submitted, they've been identified with some specific requests or restrictions from the donors. And what is coming back to us is a plea to help speed up the process of just making sure that you don't put too many limitations on the grants that you're making. What would be most useful is just to identify the grant as unrestricted or send it to the general fund. It does give these charities so much more flexibility to form critical services where it's needed most. This is a dynamic situation, so it really will help streamline how they can get the money to where it's needed most. It also actually helps us where it can streamline our process where we can get those funds out to those charities in an expedited way. In this one specific example, they're actually having to sometimes decline money because other than restricting the grants, because such an influx of funding, that emergency phase of that response, they've already met that campaign. But if they were to submit it as unrestricted, that could have gone to the next phase of support, as Anil is mentioning. So I was actually speaking to my team this morning, and we are hearing from more and more other organizations that are having some of the same problems.
Yeah, Anil, in terms of restricted and unrestricted support, any comments there? Of course, unrestricted is a little bit easier, I believe, for your use, right?
Well, that's right, but to be honest, at an organization like the WHO, this is already a restricted fund. So if you're donating, and I put the link in the chat, if you're donating at ukraine.who.foundation, the funds that are being given only to the Ukraine response. And the majority of those funds, we have the budget for that response is public. It's $57.5 million for the first 3 months. We're already a month into that. Only 40% of those funds have been raised, but how that money is going to be used is spelled out very specifically in the document. The majority of it is for supplies. When there's an emergency response by the WHO, they actually minimize their overhead. So I appreciate unrestricted funds to nonprofits. I've run nonprofits before. The WHO Foundation needs help. So I really appreciate that, Sam, but I want those on this call who are advising donors who are philanthropists yourselves to know that in a moment like this, you can have a high level of confidence that if you're going to an organization that's trusted like WHO, the majority of funds are being used for exactly what you want them to be used for, which is to respond to this crisis, and they're being spent very quickly. So we're not looking for funds that are going to sit in the bank. These are funds that are being spent very quickly, very specifically on Ukraine.
Right, and it goes to the point, this is where the charities that are having these issues, they want to create that complete transparency, and that's why they're making these requests.
Yeah. Yeah, and Sam, keep going there, because you're talking about, you work with thousands of donors and professional advisors. So why don't we start with the donors first, because the advisors, we have a long conversation about that too. But how are the donors responding besides, talking about restricted gifts and any concerns that they have?
Well, obviously the donors have responded swiftly and generously. It really truly has been amazing, the world coming together in response. And for us, what we see in time of crisis, donor advised funds really have traditionally responded very quickly, and it helps us stabilize that giving also. So what we're seeing is just record levels of granting. So just to give you a little bit of numbers, since Russia invaded Ukraine, Schwab Charitable donors have nearly granted 13,000 grants, totaling $36 million just in 1 month. And those are dollars that have been earmarked specifically for this response. So the actual numbers are significantly larger, where there's been tremendous amount of granting that have also not been earmarked just specifically for Ukraine. And we see this through all types of crises also. So As an example, in 2020, on the onset of the pandemic, DAF donors responded very quickly, increasing their giving significantly, both domestically and internationally. And even just before Ukraine, we saw a huge influx of granting due to the crisis in Afghanistan. Again, so donors really are able to respond this quickly because they have a plan in place where they have dollars set aside specifically for crises such as this. So that's what we see from our donors, where they are taking action as needed.
Well, I'm just happy to share some stories from our side, which I hope will inspire those on the call. But I also want to take a moment after I do so to take a wider aperture, because I think Ukraine is motivating generosity right now. But there are 80 million displaced persons in this world. So 10 million in Ukraine, but there's many more, and there's many health crises. The number of people who are at risk of starvation in Yemen, in Tigray, obviously the conflict in Afghanistan, as Sam mentioned, there's a lot of need in this world. In terms of our mobilization of resources for WHO's work in Ukraine, there's many wonderful stories. One person named Stephen in the US gave $20,000. On the other hand, we've had 34 people give online, an average of $130, but that's raised $500,000. Hundreds of people have launched personal fundraisers. One person in Germany has an incredible network and has raised $300,000 by connecting us to companies and networks that he knows. We've partnered with Benevity, so companies can facilitate and match employee given. And many businesses have given directly. Facebook, for example, both donated money and ad grants to amplify our appeal. Again, we are very aware that so much has been given, and I'm grateful for that. Many organizations have exceeded their fundraising targets. I happen to represent one that's only 40% of the way there, and I think it's because healthcare is not necessarily seen as the most urgent need, but of course it is, as I described to you in the stories that I was able to share. And also, sometimes WHO or organizations like it are considered to be well-funded by governments. But in fact, governments do not fully fund the response of institutions like the WHO or HCR or UNICEF, and individual donations matter. And particularly in moments of conflict and crisis, the giving of philanthropists can actually push and inspire governments. So your contributions are very much needed. One of the things that I've been sharing to philanthropic networks this last month in terms of how to give is, first and foremost, set an intention and then follow through on that, rather than just reacting in a moment of crisis. The needs are substantial. They're going to last a long time in Ukraine, and there's many places of need other than Ukraine. I'm someone, just in my personal giving, after I do my tax day is coming up, April 15th, and after I do my taxes, 5% of the income that remains after I pay my taxes goes into my personal giving. And once I've set that intention, I know the giving will occur. And there are many places where you can give well. Many of you, I'm sure, work with donor advised funds, but I would use this moment of crisis and humanitarian need and the stories you're hearing to set an intention to give generously, and then worry about where the money is going and get help from people like Sam to make sure it's going to places where it's going to have impact.
It goes back to the conversation about effective giving, right? Ukraine and all these crises are happening, not in our backyards, but overseas. So how do we know the gifts are being used effectively in the most strategic way? So can you talk a little bit about what your recommendation is, Sam, to donors?
Yeah, so, as Neil's mentioning, there is the how. What you're talking about then is the who, right? And that is a concern that we do hear a lot about from our donors, where it's just not about the money and how it's being used, but also understanding the impact that money is making. That is a lot of the questions that we do receive. One of the recommendations that we always make is, don't go at it alone. You definitely do need to do your research on where and how you want to give, but it's also important to utilize the resources that are available out there. We collaborate with the Center of Disaster Philanthropy to help identify charities supporting responses and relief efforts. And we publish that on our website for our donors and advisors. The reason we like that is all those organizations that are recommended are vetted 501c3s. They have solid histories of providing service in and around Ukraine, as an example. And those organizations know how to deliver those services in the moment based on the current situation, where they have feet on the ground and understand where the need is most. So there are other resources out there. I'm sure everyone has heard of Candid or Charity Navigator and Charity Watch. All of those can provide information on how efficiently a charity will use those donations to fund their programs.
Great resources. I mean, one of the things I noticed with information flow, right? In order to get donors to respond and, effectively and motivate them, they also want to know what's going on the ground. And I know you produce a lot of situational reports and all this and try to get this information out. Can you talk a little bit more about that process?
Yeah, absolutely. It's a great point, Dien. And I think one, in terms of how to inspire confidence in giving, it's the track record of organizations, it's transparency on how the funds are going to be used. Our appeal makes very clear where the funds are going to go, but then it's also reporting on how the funds are being used. So I'm really grateful to be on a call like this because I can tell you, here's what's happened in the last month. The WHO is publishing on its website, which is linked to our donation page, situational reports, as Dien mentioned, which says, here's exactly what the WHO is doing, here's what we're learning and seeing, and we're also trying to translate that to the public through the media. So honestly, the people, the emergency medical teams, these are volunteers. These are people who don't work day in and day night at the WHO, but when they're called, they get on a plane, they go into harm's way. And in addition to providing care, they're also documenting what's happening. So every image that we see in the news, every story that you're hearing, including the stories that I was able to be a representative of, those are coming from people who are on the ground, and their voice matters because it keeps the conflict relevant and it reminds us what's actually happening, how the giving that we are mobilizing is being used.
Yeah, and we talked previously, and you had said that a lot of these folks are actually from the local area. Right? They know the community, they know the cultural nuances and all. Can you tell us a little bit about how that process works? The volunteers are being recruited and mobilized?
Yeah, so this is, again, I have a lot of confidence in many organizations that are working in a moment like this. But the reason why I work for the WHO Foundation is because the WHO is already there. So the World Health Organization had a team inside Ukraine that was populated by Ukrainians that worked with the Ukraine government and the Ukraine Ministry of Health. So organizations like the WHO are pre-existing partners on the ground. So this is not people parachuting in. And by the way, sometimes in crisis, you need people to parachute in. But in the case of the WHO, this is a pre-existing relationship. Prior to the conflict, the WHO was already working with the Ukrainian Ministry of Health to expand access to healthcare, also to do an assessment of the healthcare facilities and preparedness in the event of an emergency. So that work was already underway, and it was by the Ukrainians who populated the WHO's team. Despite calling it the World Health Organization, it is the name. People often, when they hear that, think most of the people are sitting in Geneva, which happens to be where I live. But 70% of the people who work for the World Health Organization work inside the country and regional teams. So most of the WHO is not Geneva. Most of the WHO are people who are from these countries who work right alongside healthcare workers and government officials.
Thank you, Anil. I'm going to shift a little bit now since we've spent some time on donors. I want to talk about advisors. So Sam, Schwab Charitable works with advisors such as CPAs, wealth advisors, philanthropy advisors, attorneys. And since, we educate, right, the advisors, and I truly believe they are the gatekeepers to wealth. Can you talk a little bit about that, Sam? What are the advisors asking? What are the challenges that they're facing?
Yeah, so advisors are really well positioned to help support the client's charitable giving. What we hear is that they are deeply engaged and involved in a lot of the conversations with their clients about the relief and response efforts. First of all, I would just start off with saying that we do see continued increased desire among clients to really align their investments with the interest with their personal values. And what that means from a charitable standpoint is more and more investors are thinking holistically about investing and philanthropy together. There was a recent US trust study that found that clients' wealth plans are increasingly including philanthropic instructions within it. And we hear directly from our advisors that engaging clients in charitable giving really deepens those relationships also. So there was a recent study that Charles Schwab had done. 85% of advisors are providing some value in deepening those relationships by providing some of that charitable advice. So not to mention understanding those client goals is an important factor of really looking at more of a holistic and complete financial plan. I would also say that for advisors who are currently in discussions with their clients about giving, it is a great opportunity to do so. You can approach those charitable-minded clients and let them know how they can help and provide some of the resources that are available. You may have already worked with some of these clients before in charitable decisions. You may have walked them through some charitable tax deductions previously. And since we're right in the middle of tax season, we've seen many advisors that have really started those conversations right now. One other thing that I do hear about some advisors, they're actually hesitant to bring up charitable giving to their clients. And it's because they don't want to be disrespectful or create maybe an awkward conversation if the clients are not giving in any way. But what we've actually found is that for the ultra high net worth community, 80% are already giving in some way. So, most of them are giving. It's really just starting that conversation. And if you start off with their overall goals and planning, it's an easy way to introduce charitable giving concepts.
That's great. Yeah. Anil, any advice for the advisors that are working with donors? How do we encourage them to make that gift or come with it with much more intention? And knowing, of course, that disasters come with kind of the immediate needs, right? The short-term and the long-term needs. And we all have attention span issues, right? So how do we kind of get over this hump?
Sam's a better person to answer that than I am, but I'm happy to add a couple of thoughts. I mean, I think one is, and you were already getting at this, Dien, is to not be afraid to ask the question. And secondly, to encourage a setting of intent, because once the resources are set aside, then you can sequentially answer the question, okay, is this a tax deductible charity? What's the impact? What's the reporting going to be? Are there other donors who are giving to this organization? Those types of questions I find sometimes become a constraint to the giving. So what I do for myself, or what I can tell you what I do with my mom when I'm encouraging her to give, is to say, first, decide your giving, set aside an amount, make that intention, and then make clear what the questions are that need to get answered in order for you to follow through on that intention and give. Sometimes people don't know that they can give to the organizations that they're reading about in the news. That's certainly the case with the World Health Organization. We created the WHO Foundation just last year so that we could help mobilize more philanthropic resources, because the WHO is in the news every day these last few years with the COVID-19 pandemic, but it's not necessarily clear how individuals can pitch in and what their contributions will do in terms of having a substantial impact. And those are stories that your advisors can help tell you. In the case of the WHO, in fact, $250 million were raised from philanthropists in the first weeks of the pandemic, allowing the WHO to initiate the research and development and the surveillance that allowed the pandemic to have less of an impact than it already has. So these opportunities do exist. Organizations like the foundation are here to help. We do have, of course, that tax status in the United States and elsewhere. And when you go to your advisors, or if you are an advisor, I think encouraging your clients to set the intention, to ask the question, what type of impact do they want to have, and then helping them make that connection. Again, I'm sure the people on this call know this better than I do, but those are my quick reactions to the end of the question.
Thank you.
Yeah, no, if I can just add that is spot on. As an advisor, you really can add value helping your clients by thinking about it more strategically. Dien, we do have some tools and materials that can help guide through that giving plan. So we can share that with you so that we can share that with the audience also. But once you identify what matters most to that individual, you can set up more of a long-term plan, because we do know that the need is going to last years, right? So, you can do simple things as setting up a plan, making sure that you're creating reoccurring grants, so it's not just a one-time event. You can follow that and really see what type of impact that you're making.
Yeah. And that's the beautiful part of it about having a donor advised fund, Sam, right? Because money's already set aside, so you could do the immediate needs right now, respond quickly, but then have time to think about, right, what other organizations, or how do you continuously support the organization as they're going through this very long-term recovery. So
that's exactly right. You now have almost that charitable savings account that you can think both short-term and long-term. So, the way we describe it, there really is two phases of grant making through a crisis. There is that immediate relief that's needed, but then there is that longer term recovery phase. So a lot of advisors that we speak to, they're already thinking through that longer term plan, whether it's refugees, whether it's the secondary impact. So I'm sure, Anil, you have the better numbers than I do, but what I saw in the news is maybe 13-15% of the global calories are coming from grains from Ukraine and Russia. That's going to have a dramatic impact on countries such as Ethiopia and Kenya that depend on those grains.
And when I was working disaster grant making, mostly for Asia, we also talked a lot about psychotrauma. And that takes a long time, right? So and it's a lot of investment, especially with children, Anil, that you were talking about. So are you seeing any beginning developments in providing some of those emotional, psychological needs of the refugees and those people displaced inside Ukraine?
So a lot of the medical support that is mobilized in a moment like this is focused on mental health. This is a moment when, and you described your own refugee experience, Dien, when there is trauma that's not physical, it's not seen, but it's very real and it has a lifetime of impact. And so the immediate care that's being mobilized by the WHO and other partners is very much oriented towards providing that initial support. But mental health broadly as an area of giving is one that I would encourage all of you to think about for those you advise or for your giving, because mental health is talked about a lot, but it's highly stigmatized. And so actually 1 in 5 people on the planet have a mental health disorder or challenge, but that's not necessarily a clinical disease. That's recovering from trauma. That's your emotions and your previous lived experience preventing you from having a full and joyous life. And that has physical effects. I've been stunned by the degree to which microaggression leads to elevated amounts of cortisol in the blood and then associated health conditions as a consequence of this. There's a direct link between trauma and mental health and physical health. And this is an area where there's a dramatically low amount of adequate care anywhere in the world, whether we're talking about the United States or Europe, or certainly in conflict zones. So this is absolutely an area where we want to respond initially, and we are. It is a focus, but it is an area that needs dramatically more support and investment, so because it's a lifelong need.
Thank you, Anil. We're opening the questions up to the audience. And we have one, Sam, I think this is more for you, crypto giving, because I know Schwab, you have the ability to take crypto gifts, right? So can you talk a little bit about that? And maybe anything that ties from crypto to Ukraine?
Well, so absolutely. So, again, one of the messages for advisors is really looking for opportunities where many times we think about philanthropy and giving, and many clients do that through cash that's available. But another opportunity is to really talk to your donors to consider donating maybe appreciated non-cash assets. So the current tax code provides an extra benefit for those who contribute highly appreciated non-cash assets that have been held for more than a year. So donating appreciated investments such as publicly traded stock or mutual funds, or even cryptocurrency, that could really increase the amount available to the charity by over 20%. And that's because neither the donor or the charity have to pay the capital gains taxes on those donated assets. So I know that many charities are starting to look at accepting cryptocurrency. With Schwab Charitable, we are able to accept contributions that are made in crypto also.
And I assume you have not looked into crypto yet, but I believe you will be, right? So being a
we
global
are
organization.
actually, for those of you who are on the line, there's an organization called Giving Block, thegivingblock.com, that's helping nonprofits ensure that they can accept contributions in the form of crypto. So we want to make sure, as Sam mentioned, that when philanthropists want to give, no matter how they can give, that we can receive. So it's certainly an area that we're looking into. Other organizations are ready to receive. And if you're interested in giving crypto, the Giving Block is a good resource, I think.
Okay. This one, I think both of you can answer for this question. So many priorities, so many needs, especially with working refugees, or they're in all the different countries, right, that are now involved, and then Ukraine itself. How do I help my client prioritize which and what to support? Who wants to go first?
I could start real briefly. Again, I mentioned that giving guide. It really, you start with the conversation of what matters most to your client. And there are simple ways where you can really have that dialogue and step through. And then once you do that, you can then set up that short-term and long-term plan.
Anil, I think we're talking about like 16 countries now being involved, right? Or more around in the surrounding area around Ukraine with the refugees, and so many organizations working on the ground. So if you're an advisor working with a donor, how do we prioritize this? How do we prioritize our giving?
Well, let me answer first with a lens on Ukraine, then a lens on healthcare, and then a lens more broadly, because I appreciate that the question may be about any of those three. So in terms of Ukraine, I think being able to give to organizations that have a broad scope, the WHO is of course one of those, but that's helpful because we're not only operating in Moldova or Poland or Ukraine, we're actually able to operate across that entire region, and it is a regional crisis, not just a single country crisis, and we're also delivering aid in Ukraine. So the organizations that have scale and where you have transparency about how the funds are being used, I think certainly are a good target for giving in the current moment. More broadly, we exist as the WHO Foundation to be a interface for philanthropists and health. So if the interest of you as a philanthropist or of those you're advising is health, whether it's HIV or polio or mental health or climate and health equity, certainly responding to health emergencies, I hope the WHO Foundation could be a resource for you, and certainly feel free to reach out to me or to Jamie, whose information I put in the chat. But taking a step back and this broader question of there's a lot of need in the world, what do I do? Part of my answer is start somewhere or anywhere, because there is so much need, your contributions are going to have value. One of the resources I sometimes share with my friends is Give Directly. That has nothing to do with the World Health Organization. This is just me sharing a resource, and that's cash transfers to people in poverty. So it's one of the most direct ways that you can take your resources and make sure that individuals who do not otherwise have access to cash, to resources, are being given that directly. There's other advisory functions like GiveWell that help think about how you can maximize the impact of your investments. And then depending on your area of interest, let's say you have an interest in climate, then you can go to the Climate Leadership Initiative, who advises philanthropy on how to have the maximum impact on stemming climate change. So one, no matter where you want to give, there's someone who's in need, right? And if you want to just focus on individual people, Give Directly is a good resource. Two, if you have a particular area of interest, climate, health, environment, education, then there are organizations like ours, the WHO Foundation for Health, or philanthropic partners like the Climate Leadership Initiative that can help make the connection to having impact with your resources.
Thank you, Anil.
One other thing I would add here, where I've seen it really work well is it really is so personal. It becomes a family discussion. So we've seen families really discuss it at that dinner table of what means most to them. And sometimes they will take a broad approach where, maybe it's just a $50 grant to start. Like Anil is saying, if you just start somewhere, what we tell both donors as well as charities is you really need to understand what the charities are doing. And then also for the charity's sake, you really want to understand what the donor wants to do in terms of the impact that they want to make. So it's not only starting somewhere, but then continuing to build and study those charities and really having that dialogue. It should not just be a one-time, a year type of event. It should be an ongoing dialogue that you have.
And that's the beautiful part about a donor advised fund too, right? And that's why I think the tool is amazing, is because you could set aside the funds and then have some time to think about working with the family and what to do.
Yeah, and we've seen families allocate specific dollars so that even the next generation could identify specific charities that are close and near to them that may not be in line with what the parents may think. Mm-hmm. So that gives that ability also, where you can take a broad approach.
We're almost to time, so I want to give you a few minutes, and Sam, to talk about what advice would you like to share with the audience, with our participants, advisors or donors that we didn't cover, you'd like to elaborate on?
Well, I would just end by saying that, we all do need to remember that disasters are long-term events. And, there's been such a great immediate reaction from our donors. But, one of the things that we really do need to remember is that there is that longer-term recovery and support that's needed. And unfortunately, that receives less attention, right? But the crisis in Ukraine, this is going to be a year-long effort. So obviously, the sudden and brief influx of funds is great, but it could also sometimes cause some inefficiency. So having that more strategic, consistent plan, longer term, is really critical.
Thank you, Sam. Anil, closing thoughts or advice?
Well, first, if you're on this call, you care. So thank you. And I think in a moment like this, following through on that place of emotion by giving whatever you feel appropriate giving is a first step. And certainly I would be remiss to not remind you that the World Health Organization needs help. We're 40% funded in our appeal. And so if you're able to give and want to give to the provision of healthcare in Ukraine, you can do that at ukraine.who.foundation. But I really hope that this is a moment, not just Ukraine, but given the existential crisis we have felt over the last 2 years, we are not, we're going to get through this together. COVID-19 has shown us that what's happening on the other side of the world has a direct impact on me and my family. And so this is an interdependent world that we live in. And therefore, you can think of your giving honestly as investments. I mean, this is an opportunity and a moment in which your giving can have maximum impact around the world, but also can lift the world. Because if all of us are giving to each other, I think the whole world lifts as a consequence. And given the emotions that have been stirred by Ukraine, my fervent hope, especially for those of you who are acting as advisors, is that you can encourage your clients, the people who trust you, to set an intention to give more, give consistently, and then find the ways to translate that giving to impact. And there's many people like Sam, like those on this call, who can help you do that. But I think both giving in this moment and then translating this moment to broader, more sustained generosity so that we can be together in this world and help one another out. I think that's an important opportunity in this moment as well.
That's beautiful, Anil. I think that's a great close. Sam, unless you have something to add.
Just thank you for your time today.
Sam and Anil, thank you so much for joining us, the American College of Financial Services and our new Center for Philanthropy and Social Impact. And we'd love to have you back.
Absolutely. Thank you.